Despite all the efforts to curb the opioid crisis on the local, state and federal level, the number of overdose deaths in Michigan was up last year by 18%. Most of those deaths involved opioids, according to the Department of Health and Human Services, but there is a reason to be optimistic about fixing that. The CDC released data showing the number of pills prescribed per person in mid-Michigan from 2010 to 2015. The rate went down in the 3 counties in green, that's Clinton, Ingham, and Jackson. It's considered stable in Eaton and Hillsdale counties. Compare that to Calhoun and Lenawee, where doctors prescribed nearly 25 more pills per person over that 5-year period. Fox 47's Clayton Cummins dug into those numbers for us today and has more on how groups are working to fight the crisis.
Oh, chaos, complete and utter chaos.
That's how Alina Branscombe describes her 6 years of life spent addicted to opioids.
I always would go to the ERs and, I would upplay my chronic pain disorder and create reasons why I would need pain medication.
She says it wasn't hard to do, either was shopping around for doctors.
It's fairly easy to do that, to convince someone that you're really in pain. Whether it was emotional pain or it was physical pain, I knew how to get what I needed to get in order to not be sick.
There are a lot of folks that are dealing with opiate addiction right now.
Phil Pavona is the Executive Vice President for Families Against Narcotics in Okemos.
I personally have done dozens of educational sessions for prescribers, and there are many people like me, not only around here, but all over the state that are doing the same thing.
And it's that education he believes is paying off.
Physicians have been on board with this. They are not interested in being part of the problem of this epidemic. They want to be part of the solution of this epidemic.
Technology has also improved, allowing physicians to track a patient's drug history.
Now a physician, before even entering the client's room, can have a readout of whether or not they've had these drugs, like they shopped in Flint and got some from a doc in Flint and got some in Portland, and now they're here in Lansing trying to get some.
It may not be the complete solution to our nation's opioid epidemic, but it may be a good start.
It will certainly help with some unsuspecting people who became addicts.
And that was Clayton Cummins reporting. The CDC recommends only using opioids when the benefits outweigh the risks because they're so addictive. They say you should start with the lowest effective dose first and make sure you talk to your healthcare provider about the risks for addiction and overdosing. The state is also starting a major ad campaign that focuses on treatment options as well as the proper storage and disposal of prescription drugs.